as I rise to contribute to the Victorian Institute of Forensic Medicine Bill 2024, this bill modernises the process under which this important service operates. And I should say, as a commencement, I'm pretty lonely down this end of the chamber. I don't know where everyone's gone. So maybe they were waiting for me to get up and that's why they've bailed out. But anyway, hopefully they're watching on the TV screen. So, of course, this bill is significant because and I'll call it the VIFM's enabling legislation has remained largely unchanged since the establishment of the VIFM through the Victorian Institute of Forensic Medicine Act 1985. And despite the continuing expansion of its services and changes to the public governance best practice, and the VIFM was established over 30 years ago, nearly 40 years ago, and that was back when Foreigner wanted to know what love is, and back when I was in ambulance on the road in my shorts and shirt and out there trying to assist people on the road in ambulance in the great days of the 80s. And back, of course, when naloxone for heroin overdoses was expanded for mycoparamedics. And of course, we know naloxone is a life-saving medication, which is now available over the counter from participating pharmacies. And again, these are things that happen through forensic medicine and good medical practices and the expansion of medical practices for pre-hospital care. Of course, a lot's changed in the world since then, and it's time for this legislation to reflect those developments in regard to those changes. And this bill reforms and it modernises enabling legislation to better align with contemporary community expectations, and of course the Institute's role in supporting the coronial and justice systems and its interactions with other service users and partners. And this will allow the VIFM to operate from a more current foundation, enhancing its independence and effectiveness. And I've had a bit to do with the VIFM and the Coroner's Court in my previous roles at the Ambulance Union and as a paramedic. And I want to thank all the staff that make a fantastic contribution to this state and through the work that they do. And I have been involved directly in a number of Coroner's Court cases as a paramedic in those days of the 80s and 90s, and then as a union official in regard to, and of course we had a lot to do with, when I was the secretary of the Ambulance Union, a lot to do with the Coroner's Court Investigation Unit when they were investigating paramedic suicides between the period of 2008 and 2014. And the report that they tabled in regard to that was quite compelling, even though I didn't agree with the numbers of suicides amongst paramedics within that time. I thought there was quite a number more. I'd like to talk a bit about the important and diverse range of work that the VIFM perform. Of course, as I said, it assists the coroners in determining the cause of death and works to prevent future deaths, so their contribution allows for the coroner to consider the evidence that they provide in their research. They treat affected families through the coroners and through the VIFM in a very dignified and compassionate way, and I really extend my gratitude to them in regard to how they treat affected families and family members. Of course, through a partnership with Victoria Police, the VIFM adds in roadside drug detection and criminal intoxication cases, so their work is quite diverse. The Victim Survivors, which was established in 1995, which was the year that I left, or the end of that year when I left the ambulance service, their clinical forensic medicine with VicPol and that collaboration and the results that we've seen out of that. And of course, in 2023, our government granted them $19.47 million to transition to a new clinical forensic medicine service and delivery model that meets victim survivor needs and, of course, expectations, and ensures a sustainable and efficient service model across metropolitan and regional Victoria. And it guarantees forensic medical examinations can be available to victim survivors of sexual assault on their terms, 24 hours a day, 7 days a week. And there's been a lot of commentary about that in some of the contributions today. Again, human identification, and the VIFM confirms the identities of deceased individuals and unidentified remains through various methods, including dental identification, skeletal remains, and of course DNA. And we see all of this sort of stuff go on our TVs through some of the TV shows, the American shows. The VIFM has been incredible and made some incredible world firsts, and among those achievements are its partnerships with the Australian Sports Brain Bank to investigate chronic traumatic CTE and its research into technology facilitated sexual assault. You will no doubt have heard a lot about CTE, even as the Federal Senate has wrapped up their concussion inquiry and the calls on the AFL to act. And we've seen a lot of newspaper reports and things like that about the footballers that have been affected through head knocks and concussion and the tragic outcomes of CTE. And we lost a good man in Danny Frawley in 2019 who suffered from CTE, and we owe it to him and his family and players past, present and future to make sure that we're not contributing to this medical complication. And playing sport shouldn't cost you or your family everything, and playing sport is about being active, being physical and physically active, but also being safe and enjoying it, not coming out with a longer term outcome that is a serious effect in regard to your brain and then your body and what it may lead to in regard to mental health for a number of people that have suffered from those head knocks. And of course, we see there's been research done, we see CTE within women who have suffered at the hands of abusive partners. And this is a new area that the research is moving into and the forensic medicine has moved towards. And those numbers are increasing. It's not because it's happening more, it's because we're starting to look for it through autopsies. And we know of 2 women who endured decades of intimate partner violence, including dozens of brutal assaults and head injuries before they passed away. And of course, they suffered from CTE through domestic violence. And of course, we know of those 2, and there's obviously many, many more in this country, but also around the world. And of course, the findings were made by a group of pathologists from several states and territories who teamed up to understand whether the degenerative brain disease found mostly in deceased males, footballers and boxers, was also prevalent among abused women with histories of repetitive head injury, and I think that evidence is quite conclusive. Of course, the VIFM impact extends beyond Victoria, and it's been alluded to by previous speakers, and with that extending outside of Victoria, it's been a worldwide collaboration through Bhutan and the International Committee of the Red Cross in Ukraine, Lebanon, Armenia. Has also provided expert evidence for inquiries and coordinated national and international disaster victim identification efforts. And of course, the Donor Tissue Bank of Victoria, which was established in 1989 as Australia's first multi-tissue bank. The Donor Tissue Bank of Victoria provides important bone, skin, tendon, cardiovascular grafts. And Acting Speaker, if you might indulge me, a topic that I am very passionate about and one that I've spoken about quite a number of times here in this place. And I'd like to take this opportunity to also talk about the importance of organ donation. And I clearly have registered as an organ donor. They can take every bit of me if they like. I don't think they'll want much of me, but anyway, I'll encourage them that if they get the opportunity, go for it. Take as much as you like. But, in 2023, we had 1,396 Australians receive an organ transplant, which is terrific. It was an increase, but it's nowhere near enough, and we need to have many, many more people register for organ donation. I think we're at about 55% of families saying yes in 2023, and we really need to get it up to at least 70% to provide for, 1,800 Australians who are on a wait list. There's 14,000 people on dialysis, so it is so important in regard to tissue and organ donation, and VIFM is one of those institutions that supports us in that bank alone. So this is a really important bill. I do commend the AG's office and her staff, but I also finally want to extend again my thanks to the staff at the VIFM and also the Coroner's Court, and I commend the bill.